Hello everyone, I'm Dr. Vyshnavi, your ENT faculty for the PrepLadder's residency app, and today I'm here to discuss some of the few important pointers regarding the challenges faced by residents in ENT. What are the resources that the residents in ENT could use for their learning purposes? And then I'll be discussing about what I have done in my residency app, and then I'll be discussing about how you should navigate through your entire residency program. So all this is going to be a brief discussion through this entire video so that the residents should be helped and residents should be taken care of. And the whole purpose of this video is to make sure that I am there for all the ENT residents to make your life easy. So this is a basic quick guide for all the ENT residents. So let's see what are the challenges these residents face. I have myself been a resident. Each one of us goes through that phase of residency, which is quite a tough and a challenging phase. There are innumerable challenges that a resident faces, be it taking up the responsibilities, be it being in the ward with such toxic situations, being in there are innumerable difficulties encountered as a resident because suddenly you're coming from an undergraduate level where you were mostly into theoretical experience and theoretical learning, and suddenly you're pushed into a ward, pushed into an operating room, and you're made responsible and you're made to take up some responsibility. You're given duties and you need to prove yourself in each phase of life. So life of a resident is definitely not going to be easy, and along with this comes various other challenges as well. So what are the challenges these residents or all my residents would face? So basically the first thing when it comes to learning theory syllabus is it is extremely extensive syllabus. So if you see the syllabus of an undergraduate ENT, it would be way too less than what we have in post-graduation. So it becomes suddenly very overwhelming that you're going to learn so much in this short duration of time. Now, along with this learning of theoretical knowledge, you also have to learn so many other skills during this 3-year phase. It's not just the syllabus, the theory part, but yes, you also have to learn your clinical skills of how to talk to a patient, of how to take a history, how to be able to look for clinical signs and how to do the clinical maneuvers and how to diagnose a disease, how to investigate a patient and how to treat a patient. So you're going to learn all these clinical skills, which will definitely take some of your time. And along with this, you will also have to learn surgical skills. Surgical skills, again, learning is quite a task. It's not something easy because as an undergraduate, you're not exposed to a lot of ENT surgery hands-on. And suddenly when you have to learn these surgical skills, it becomes a little difficult. So managing duties, managing your surgical skills and your clinical skill learning along with theory can suddenly be overburdening to you. And as a resident, I also felt that burden. So I am here basically to help you on how to go about in covering the entire syllabus. So in the next few minutes, we will be discussing on how to finish the syllabus and what to do about your theoretical learning. The next thing, we are going to see what are the resources that residents need to use, because definitely, the resources that are there available as for an ENT resident are wide. Like there are hundreds of books available. Now, as a resident, if I'm sitting here and if I'm thinking which book to choose for one subject or which book should I choose for one topic, it becomes extremely difficult to be able to select because you do not have an experience firsthand with the book. So instead of wasting your time on identifying which book to study for which part of the otolaryngology, I shall be helping you out in understanding what are the important books for each subsection of ENT that will make your life easy so that you can go straight to those books for those chapters which are very important there and cover the syllabus in a more faster way. Now, the next important challenge that students or residents face is duties and the work-life balance. The duties as a first-year resident is going to be voluminous, it's going to be large, it's going to be hectic, and it is definitely going to take up most of your time, and it's going to be a very challenging task. You cannot balance your work, you cannot balance your life. Other than studies in hospital, you have a personal life too, which you often miss as a resident. You feel that once your exams for NEET PG are done, you're into residency, is going to be like a wonderful phase. Yes, it's a wonderful phase. I wouldn't say no to it. But because of the duties which are there for the first year students, it becomes a challenge for them to maintain the work-life balance, maintain doing their studies and doing their clinical duties as well. So here we are going to definitely understand how to manage all these situations through the entire section ahead. Theoretical versus practical learning. Now, very important is, as a resident, I was reading something in theory, but in the practical, it was not always the same. Like, say, for example, I learned a surgical step in the theoretical book, and when I saw the same surgical step being done in a different way by a mentor, it really confused my mind. So, we need to understand, where to apply your theory knowledge and where to change or modify or, reinvent and think beyond the theoretical knowledge to gain practical perspectives. So through my residency app, at select sections, wherever it is necessary, I have incorporated the theoretical knowledge as well. And I have also explained in my app how to go about incorporating this theoretical knowledge in a practical way and what could be the practical possible situations that you could encounter. So these are basically what are the challenges that a resident faces, and I'm sure there is no end to these challenges, and I can list out more and more. But for now, these are the top challenges that each and every resident, be it an ENT resident or general any other resident, they would definitely have these challenges ahead in front of them. Now, what is the strategy? Now, how should you go about in preparing for your ENT examination? See, of course, we all want to clear our residency and we want to go out and practice as consultants. So here, the important point is it just the exam that you're targeting, or is it also that you're targeting to become a good clinician and a good surgeon? So we need to understand that our target is not just the final theory exam. We also want to become good clinician and good surgeon so that we will be able to deliver the best to our patients. Now, the strategy would remain different for each year of residency. Now, if you're a first year resident, you have 3 years of time. Practically not complete 3 years. It would be 2 years and 6 months, 2 years or 8 months, because you would have lost some time during the process of counseling, and which is why your duration is not complete 3 years. Sometimes it is a less than 3 years, a few months less than 3 years. So if you're a first year resident, you can really plan up your schedule very well. Like, you can definitely make sure that you do at least one reading of Scott Brown cover to cover. You can take up sections, like say, there are 3 volumes. You can take up each section or each volume for about 2 months. Study each volume for 2 months, and in the first 6 months, you should be able to give a first read, or you should be able to just skim through the entire book first, cover to cover. That can be done by a first year resident for sure. So the important thing that you have to do is, as a first year resident, you must go through at least one reading of Scott Brown. Now, along with this, we on PrepLadder offer you some Q bank and treasures which will help you practice the entire syllabus in a different format, so that your knowledge gets more stronger and your foundation gets more stronger with the practice of questions. So you can do Scott Brown, you can do Q bank, you can do treasures, you can read multiple books, you can do your duties, and you can also start learning your surgical skills as well. So as a first year resident, I'm sure that for surgical perspectives, if I have to tell you what you need to do, you need to at least basically be able to do a septoplasty. You must be able to do a tonsillectomy and adenoidectomy. So when it comes to theory, you need to know at least, you must have done at least one reading of Scott Brown, and if possible, do the Q bank and treasures. And surgical perspective, I would say that at least you should be able to do a septoplasty, tonsillectomy, adenoidectomy, and if possible, a myringoplasty as well. Along with this, yes, you should know basic suturing methods. You should know how to drain incision and drainage of an abscess. If there is an emergency, cricothyrotomy and a tracheostomy, these are definitely things that you should be able to do as a first year resident. Now, when you come to second year, or if you are a current second year resident, now you are in the middle part of your entire course. You are not really overburdened with the duties because you have juniors now who will be taking care mostly of the entire night duties, and you would definitely have lesser duties as compared to your first year of residency. So now is the time that you make most of. Now, this is the time you need to recognize what you're really interested in. In ENT, we have got different subspecialties. So in ENT, we have got different subspecialties, like we have got otology, We have got rhinology and anterior skull base. We have got laryngology. We have got head and neck surgery. We have voice or voice clinics. We have allergy as subspecialization. You have OSA as a subspecialization. So second year is a time when you have all this time available to understand each part of ENT, be it ear, be it nose, and be it throat. You should be able to understand what is your liking in this subspecialty. Now, this is the time you're going to cover your Scott Brown along with additional books. Like, what are the books? I will tell you. So, you can use additional resources along with Scott Brown in this second year. So, you will finish your first reading of Scott Brown in the first year. You will continue to do Scott Brown in the second year for a second read, but now you're going to supplement it with some other books. Like for otology, what are the books? For rhinology, what are the books? I will explain to you as we go. Now, when you're in your third year of residency, this is the time where you need to shift your focus. Third year of residency, especially the last 6 months, you should be able to only focus on your exams. So here you should be able to focus on your exams, and the main important thing here would be to clear your theory and your practical exams. So this is the time where you have to integrate all your first year and second year knowledge. You should have had made notes by now, and you should be able to revise. You must be able to get your university examination papers. Take those papers and start revising and reading the questions and answers, and make your own answers, make your own diagrams, make your own flowcharts, make your own way of representing, plan how you would answer a question when given in the examination. If it's a short note, how would you represent? If it is a long essay, how you would represent? All of this planning should be done before. It cannot happen that you go in the exam hall and think that, yes, everything is going to work well, I can write everything. No, you have to make all this planning in your third year. Now, when it comes to surgical skills that you need to don in your second year and third year would be, so in your second year, the surgical skills that you should definitely know is you already have learned septoplasty, tonsil and adenoid, myringoplasty, and basic incisions, incision and drainage, suturing, all of that is in your first year. Now you will start doing a little bit of FES. Maybe you can do initially an uncinectomy and a middle meatal antrostomy, and you can do an anterior ethmoidectomy. Slowly you can go to explore the frontal sinus. Slowly you can explore to the sphenoid sinus. So this is the time where you should do under observation at least a FES. So functional endoscopic sinus surgery is something that you should target in your second year. Now, along with this, should you also target in ear other surgeries? Yes, like tympanoplasty and mastoidectomy. So tympanoplasty and mastoid surgeries, at least cortical mastoidectomy, you should be able to undo it. If not modified radical, cortical. You should be able to harvest a temporalis fascia. You should be elevating the tympanomeatal flap. You should be understanding how to place a graft underlay, how to freshen the edges of perforation, how to understand ossicular mobility. If there is a mastoid disease, how to identify the Mac-Evans triangle and go into the mastoid antrum. All these techniques should be done by your second year. Now, along with this, you will definitely be given sometimes chances for doing laryngeal surgeries as well. Like basically they can tell you that put a laryngoscope and fix the microscope. Sometimes they can give you simple lesions like vocal polyp, vocal cyst. These lesions can be understood. So here you are basically trained to do most part of ENT surgeries. And in your final year, in your third year, in the first few months of your final year, you will definitely be able to do almost all the basic surgeries in ENT. Now, this is the time when in your third year that you should be able to do all basic surgeries for sure. And now you should be able to understand what is the subspecialty that attracts you. So that subspecialty identification you should be able to understand by the time you're in your third year. So this would be your strategy for theoretical exams and for practical learning in terms of surgery. So theoretical first reading of Scott Brown in the first year for sure. We don't have so much time, so you do it in the first year. Second year, complement it with other books and make your notes. Third year, target exam specific questions, take the university papers, make your long essays, make your short essays and know how to represent it. And that's how you can compile your entire syllabus to be able to clear your exams very well. Now, when you're doing this way, that you're already learning your theory, you're already doing your surgeries, making you competent for the practical life that is ahead of you, and also for the practical exams that will be there for you after this. So your 3 years of residency will be a complete power pack learning with this strategy that I have mentioned to you. Now, let me explain to you what are the books you need to follow for your residency. So, the Bible of ENT is going to be your Scott Brown. There is no replacement for this book in your residency. You must and should finish this book at least for the most important chapters. You should be reading from Scott Brown, because that will form the foundation, and your foundation has to be strong because you're now going to specialize in ENT, and you need to definitely learn the core book very well. For anatomy, you can learn from Renuka Brado. So you can supplement the anatomical part from Scott Brown with Renuka Brado. For otology, you can use Cummings or Glasgow Shanwalk. Very, very nice books at areas like, say, CSOM, or if there is a surgical part that you really need to understand, then you can go to Glasgow Shanwalk. Very nice book, clearly elaborates almost all the diseases of the ear, how to diagnose and how to treat as well. So supplement for otology section with these two books. For rhinology, a very nice book is by David Kennedy, which you can read for all your rhinological diseases, especially for rhinosinusitis. It makes sense to read from these prominent authors. And also for surgical aspects of rhinology, like endoscopic sinus surgery or transphenoidal surgeries, you have a very nice book by Peter J. Wormald. We have Indian authors as well who have given their insights into various articles and various, various books written by them. So, of course, very, very good books are available. We have Dr. Janaki Ram, we have Dr. Nishit Shah, we have got Satish Jain sir, and there are so many other prominent people. I might have missed a few names, but there are many, many people who have given relevant articles for relevant topics in ENT. So, you can definitely supplement with those articles for your current learning. For laryngology and head and neck, Stellan Maran is a very nice book. It will clearly tell you, in the head and neck, the spaces. If you're talking about laryngeal cancer, the types of laryngectomies, what is the difference between each type of laryngectomy, how to go ahead in head and neck lesions, how to evaluate and treat. Very nice lessons are there from Stellan Maran. So you can supplement your head and neck surgeries with Stellan Maran. Quick Indian guides, we have five books by Dr. Bachi Hathiram and Dr. Vicky, and that is on otology, rhinology, skull base, and head and neck. So we have got a volume of 5 books by these authors, which is a quick guide for all of you. We have a recent advances book by Dr. Anil Lalwani. So definitely that will add on to your, recent advances. You can learn from them. And we can also go to Hazarika, Dhingra, and these are the Indian books that you can refer to just in case you want to quickly finish the syllabus and you're short of time. Now, what is the thing that I have done in my residency app? So residency app, the source that I have used is going to be Scott Brown only. So majority of my source is going to be Scott Brown. What is the reason why I chose only to do Scott Brown? The reason why I chose only to do Scott Brown is because that is the book that most residents fear to touch. And by my lessons and by my video recordings, I will make it so simple that once you go through my lectures and go through Scott Brown, you will start loving the book more. You will stop hating it, but you'll start loving the book, and that will push you to read Scott Brown even more. So that is the main reason why my primary resource is Scott Brown, so that I can get the residents to studying Scott Brown directly. I don't want them to miss on it and go to some shortcuts. So the reason is I have put most content from Scott Brown. Additionally, I have also given updates. So if there is an update that has been missed in Scott Brown, or if there is an update that is relevant for the current times, I have added them in the chapter so that it becomes easier for you to know the current information as well as the Bible in one go as it is. Now, what are the choice of chapters? Have I covered entire Scott Brown from cover to cover? No. I have not covered entire chapters of Scott Brown. I have covered the most important chapters. I would say mostly about 100 hours of syllabus has been covered, and the chapters would be somewhere between 85 to 90 chapters we have covered here in the app. So we will be I have discussed most important chapters that are relevant from exam point of view. These 100 hours, I have covered the most important chapters that are important from your exam point of view, from your clinical point of view, and from the point of view that you're going to emerge as a competent ENT physician and surgeon, and you need to know these topics really well. So I have incorporated the most important content in the current residency app. Of course, I will with eventually with time add on more content, but for now it is being delivered keeping into focus the most important topics which are asked frequently in the university exams and the national board exams. I have put all that content as the first priority. Now, understanding the concepts, I have simplified it so that the language that is there in Scott Brown becomes little difficult to understand and relate to. So I have made that language quite easy. I have used illustrations, I have used flowcharts, I have used images so that you get the understanding of Scott Brown, but in a much more easier way. And I have simplified the topics to as much as possible so that students are not fearing Scott Brown anymore. Now, how it can help you? Of course, during residency, like I've already discussed, the first year of residency is going to be a tough phase. And now in this difficult period and difficult point of time, you need some help. Of course, there are many things that you need to do by yourself as well. But somewhere, if there is a help given to you, I'm sure you will be able to finish the syllabus quickly, be able to manage your duties very well, give time for learning clinical skills, and also have a good work-life balance. So this help will definitely make a difference in your day-to-day life as a resident in ENT. You'll just feel like somebody is there with you. Somebody is, just taking care of what you need to learn, and everything has been packaged and given to you in a much easier way. And you no longer have the fear of how do I go about navigating through ENT. I have somebody whom I can rely on, and that person is going to be me. So I will be there through your entire journey, so as to make your life as a resident much more easier, because that's my primary focus. In some areas, there's a lot of toxicity as for residents. In some places, the residents are taught very well. We cannot really judge each institution, but of course, for whatever reasons, if you have any problems, I would definitely be there to make your life in learning ENT at least quite easy for all of you. And the way we have simplified the subject is going to definitely help you crack your theory and practical exams in the most easiest manner. So we have the QBank by PrepLadder. So whatever I'll be teaching to you in the theory modules, you will have questions from those theory modules so that it will make you understand, have you really understood the concept, and be able to apply that. And it's a fun way that you're engaging into learning by doing more questions, and that questions will actually give you an active recall of whatever you learned, and it will get just stored very well in your mind. We have treasures. Treasures are small clinical situations or vignettes which will act as a reminder for quick revision for all of you. And notes, basically making notes can be laborious and a time-taking task for you as a resident. So to simplify that, along with my theory module, notes have been aligned so that you can integrate well them together and be able to learn the entire ENT very well. So this entire package that we have made is definitely going to make your life easy as a resident in ENT. So with this, I hope I have been able to answer some of the questions that you as resident may have. I will be coming again, maybe even live, for discussing your issues, your problems, what you need, what are your requests from me, what would you expect out of the app, what would you need more. So that understanding will definitely give me insights on how do we go in stage 2 of making this app a little better and making more relevant for your needs. So let us know in the comment section below, what do you require further in ENT apart from what I have discussed. So I'll take your leave for now. All the best for your learning, and I'll see you again. Take care and bye-bye.